We are here at the community booth of Rhine-Westphalia, or in English, North Rhine-Westphalia. It's a German state with a deep history in heavy industry, but it's also a state that's done a great job making the jump to high technology, really cutting edge, digitalization, med tech, and every other realm of high tech industry. We're showing a couple examples of that. The first one is Refined Laser Systems. It's a company that's using laser technology to enhance the detection and treatment of cancer, among other things. Dr. Brinkman, thank you for joining us today. Give us a little bit about background about your company.
Yeah, good morning, welcome. So we are Refined Laser Systems, a young company based in Münster, Germany, and we are exhibiting a laser-based microscopy technique which to accelerate today's clinical process of tissue diagnostics.
And where do we find this? What's the advantage to practitioners, clinicians, and pathologists?
Yeah, so we are addressing an issue that can be seen all over the world in clinics. For instance, during cancer surgery, at times it's very difficult for a surgeon to identify the exact margin of a tumor and so to remove every last cancer cell. And so today what a surgeon does is he or she sends a biopsy to a pathologist for a detailed tissue diagnostics to identify the exact margin. And this pathologist, he stains the tissue by two chemicals into this pink-purple contrast to identify cancerous structures and to diagnose these. But this process takes up to 10 hours because there are several labor-intensive steps required, especially the staining with external markers. And with our technology, which is sensitive to intrinsic markers of the tissue, we don't require external markers to generate this contrast, so we can speed up the whole process to just a few minutes.
I know that especially skin cancer operations can take an incredible amount of time. Is this the reason for this? Kind of the analysis of tissue as it's going through the process of removal?
Exactly. There are a certain amount of cancer surgeries, especially skin cancer surgeries, which have to be prolonged because the surgeon is waiting for microscopic information from the pathologist, or there are surgeries which even have to be repeated at a later time because the information came not in time. And we are addressing exactly this issue too. We want to place our device in the surgery room, generate the so-called H&E images in just a minute, and connect surgeon and pathologist digitally.
Now you have startup written on your column back here. Where are you in the stage of commercialization and development?
Yeah, correct. We are a spin-off from the University of Münster, where we have developed very sophisticated laser systems, which we have already commercialized. So we are selling our laser systems, the Picos Duo product series, mainly into the research market to other research institutes. And now we are in the process of integrating the laser together with a laser scanning microscope into a compact medical device.
Great, thank you so much for joining us, finding the time and discussing a very important development to ultimately decrease surgery time. Very important. Thank you.
Yeah, thank you.
And moving along here, we do have this corner booth here that we're finding very attractive. Robots are always very attractive at a show, but what we've been speaking about to this point is automation, efficiency in processes within the hospital. United Robotics Group is offering something a bit different. If we could find somebody to speak to. Mr. Pull, do you have a second? Should we find somebody else? Thank you very much. Sorry, I didn't mean to interrupt the conversation. As I was saying, this isn't necessarily systems about automation and efficiency, but actual, just tell us, what is the company presenting here?
So we have a combination of several robotic systems. So we built up some kind of ecosystem, and in the United Robotics Group we have several companies which are focused on several special tasks, like integrators on the customer side, software specialists, and also like powerhouse for new robots. And what we do currently is some kind of combination of social robots like Pepper, and also service robots like Plato, who is the first European competitor for logistics. So this is what we integrate, and we bring it on me for especially because I'm mostly responsible for the vertical health and care. So I talk to hospitals, talk about their possibilities for service, what they need for relief. Because with the current Pflegenotstand in Germany, we need technology to help there, and this is what we're doing.
And are these being implemented already in institutions? Have you gotten feedback from how they're being accepted by patients and workers?
Yeah, so we always go from the customer perspective. And what is very important, because when we talk about robotics, is always the tendency to say, okay, do we replace humans? And we want to amplify that. We want in collaboration, so human side by side to the robot. And we get feedback from the German Red Cross, from several Caritas institutions, and also in other sectors, because I'm only in, as I talked, health and care, but we also serve like gastro hospitality, maintenance, and different sectors. And we always get the feedback from the specialists in their field, so that we know what we have to solve or we can give as a service.
Right, not being well accepted and utilized. Thank you for finding the time to speak with us. I'll let you get back to a very busy booth here. Get back to work. Thanks a lot.
Yeah, have a great day. Thank you.
And finally, I hope we have enough time here. We're speaking to a company that is not necessarily, it doesn't pop out at you as being very technologically advanced. Please, you do have time. Thank you for speaking with us. You're dealing with needle technology, machining of fine needles, etc. Not necessarily something me personally I would consider as being high tech, but you do have a lot of technology behind these systems. Tell us a little bit about it.
We have here a wide product range of needle guides and biopsy products, and we are here very happy to provide high quality products for competitive prices, and our aim is to really give a wide range and a wide share of people high quality products at their hands.
What specifically makes them high quality? What is the market looking for that you're able to provide somewhat better than competitors?
Let me give an example. Yeah, we have here our full automatic biopsy disposable needle. We especially take care about high quality steel, about a sharp tip, and what's most important, and maybe you cannot see, we take care that the firing is provides a very good mechanics. This is our aim.
So simply just a very high quality tool.
A high quality tool where you cannot see all the features from the look, but inside it's really a premium product.
And going forward, what advances do you see continuing to drive your area of business? What's going to improve outcomes and operability?
Again, what is the most important thing is that we optimize the penetration curve, and this is to be seen in connection with the tip, but also optimize the acceleration of the spring and the power of the spring. In this field we see the most decisive point, and for the future we see that there should be a good connection between the imaging and our products. So this might be the future, that there's some communication between product and imaging.
All while keeping an eye on the cost.
Of course, this is the most important point. We would like that our customer, a big share of people can be served with our product. So under a cost benefit perspective, we would like to provide the people with a good product.
Now, in my introduction, I was saying that Rhine-Westphalia is known for heavy industry traditionally, but making a big jump to high tech. How does the government and the state support you in your activities?
Yeah, we are very happy, firstly, to be here on the fair. This is a great opportunity for us to meet our clients, to understand what are the clients' wishes, how can we support our clients. And under the umbrella of North Rhine-Westphalia, this fair is a big opportunity for us to show our products, to meet the customers. So we say a big thank you to the state of North Rhine-Westphalia to be here under this umbrella.
Mr. Welleshofer from weLLgo, thank you for joining us today.
You're welcome. Thank you.
So there you have it from some individual exhibitors here, kind of giving a good example of this bridge from traditional industry to high tech. Continue to join us here at the Medica this year. The days have been very full, and we're going to continue reporting throughout the course of the show. Thank you for joining us, and until next time.